And once we've looked at these three approaches, we can consider what type of patient profile can be treated with Apremilast. In general, these would be patients with mild to moderate psoriatic arthritis and enthesitis that is not severe and does not involve significant structural damage. However, it is generally not recommended as a first-line treatment in cases of severe arthritis or more pronounced axial involvement. Psoriasis can even be moderate to severe in patients who cannot be treated with other biologics. And in addition, it's important to consider that these are patients with a low risk of structural progression. You need to review the X-ray, take a closer look to determine whether we're dealing with a more or less aggressive disease. But ultimately, it's a treatment that can be a very good option for those cases of refractoriness or intolerance to conventional topical treatments when we're talking specifically about cutaneous psoriasis. Patients who prefer oral treatment and patients whose comorbidities may further limit the use of other biological therapies, such as, for example, those with a chronic or latent infection with hepatitis B virus, HIV, hepatitis C virus, even in patients with liver failure, no dose adjustment would be necessary. And in the case of renal insufficiency, the same dose can be maintained until a situation where the filtration rate drops below 30, at which point the dose would be reduced by half. For patients with a history of cancer, in principle, there would be no contraindication to prescribing it, and it has also not been associated with cardiovascular or thrombotic events. As relative contraindications or limitations to keep in mind, patients with severe axial involvement, significant structural damage seen on radiographic imaging, or patients who require a rapid response, this would be a slower acting treatment, for example, such as a side effect to keep in mind, and that we can warn our patients about. Headache is a common side effect, and especially gastrointestinal issues, diarrhea, nausea. But above all, these occur mainly at the beginning of the treatment T, and since the dosage starts low and gradually increases, it's normal for the patient to eventually get used to it, and it shouldn't be a reason to discontinue the treatment. It is important to be cautious, and it has been documented even though it is very rare. Suicidal thoughts can occur in at-risk patients, including those with depression and similar issues. Treatment is not advised.